Hey, my name is Joseph. This video is the psychopathology discussion, and I'm just going to talk about first off, the difference between psychopathology and normal mental health functioning. Psychopathology is the study of mental disorders that has clinically significant behavior or psychological syndrome or pattern that occurs in an individual that is typically associated with either painful symptom or impairment in one or more important areas of function. And normal mental functioning is basically the ability to regulate behavior. Our textbook also, on page 6, the third paragraph, adequately, in my opinion, defines that a mental disorder is any syndrome with clinical significance that disrupts an individual's cognitive, emotional, or behavior regulation and causes dysfunction in their psychological, biological, developmental processes on their day-to-day basis. And the first step in helping someone with a mental health disorder would be identifying that disorder and specifically the area that is causing abnormality, or what area of their life is having dysfunction. Not so much rushing to a diagnosis, which we'll talk about later, but in identifying specifically what area of their life is having problems. And I guess the manner of degree, which is really what diagnosing is all about, as to what manner of degree, and kind of leads us into the key criteria in determining the presence of a mental disorder is observing behavior, how consistent, how frequent, any scores on diagnostic tests that can measure the degree of the dysfunction, and qualitative interviews with the subjects or people, relatives, friends close to that client, gauging that individual's suffering, again going back to the dysfunction, the area of dysfunction, to what degree, if they're unpredictable, irrational, if they have unconventional appearance. These are all, of course, to manners of degree, and we'll talk about later is how cultural norms could tie into mental health disorders, and so a severe or clinically significant degree of those things listed would lead to determine that there is a mental health disorder in an individual. What purpose does making a diagnosis serve? Knowing that disorder or a diagnostic impression of that disorder can plan and appropriate for treatment for that individual. You can't treat something unless you can adequately identify it. There's lots of other people, organizations, agencies, government institutions that depend on accurate assessments and diagnoses, court systems to determine the competency of an individual to stand trial, insurance adjusters to determine if someone is in need or eligible for a disability check. There's also research purposes. It serves to make an adequate or an accurate assessment. And of course, there is always disadvantages to everything, pros and cons. In our society, well, up until recently, as the video in the module with Dr. Zimbardo talked about, the social stigmas up to recently that were associated with mental health disorders. People were dehumanized, treated very poorly, treated as animals, as test subjects, subject to ridicule and dangerous, awful treatment. That still plays a part in modern day now, unfortunately, with the experiment done by Dr. Ramshun. It also in the video, forgot his name, but the doctor that claimed he heard voices but then acted normal and saw how poorly he was treated. Nobody wanted anything to do with him, and that's still true to this day, where there are social stigmas attached to diagnoses and labels that accompany especially schizophrenia and other severe mental health disorders. There are other disorders that also have stigmas and various ethnicities that may be prone to have more severe diagnosis is made instead of less severe alternatives. And without getting into any specific example, it can all be mitigated by a social worker being knowledgeable about culture clash, of how mainstream culture has historically opposed the minority cultures, especially when it comes to mental health. I think having a good grasp of the history of where mental health diagnosing and treatment has come, from drilling holes into people's heads to the DSM-5, and appreciating what all has happened for the positive and the negatives in that time span, and just the social worker being aware and not being dependent on just that social worker's opinion, having colleagues to bounce ideas and opinions off of before rushing into diagnosis.